Hi, everybody. We are going to discuss the digestive system lecture today. We are going to focus on both the gross anatomy and the microscopic anatomy with very little discussion about physiology. So let's go ahead and get started. We have learned about the regions and the quadrants of the abdominal pelvic cavity earlier in our semester. But just kind of a refresher in terms of where you can find each of the organs and the breakdown. We had, for the quadrants, we have two on the top and two on the bottom. The two top ones are right and left upper quadrants, and the two on the bottoms are identified right and left lower quadrants. Please do note as we go through the PowerPoints, I do expect you to know by the end of this lecture that what each of these organs can be, where each of these organs can be found based on the quadrants and the regions of the body. So it's again depicted in the picture right here. If you do not remember the terminology for the 9 regions of the abdominal pelvic, please go ahead and spend some time on your own reviewing the terminology, or go back to your first unit, Introduction to Anatomy, to get an overview of the content. So go ahead and we're going to go ahead and start with the components of the digestive system, starting with looking at some of the main organs. So one of the things I always tell my students to note is we have what we're identifying as the path of food through the digestive system, which is better known as the alimentary canal or GI tract. And then you also have what we identified as accessory organs, things like your liver, your salivary glands, your pancreas, gallbladder. They do not allow the food to directly pass through them. However, they do contribute to the process of digestion and absorption of the nutrients. So looking at this, again, kind of getting an overview of the digestive system, you have your oral cavity, 3 sets of salivary glands. We'll talk about the terminology in a few minutes. The tube that collects the food, the back of your throat or your throat itself is the pharynx. Coming down the thoracic cavity, you have your esophagus, which ends in your stomach. A stomach is connected to your small intestine, which are the main folds in the center of the abdominal cavity. And this itself is broken down to 3 parts. We'll talk about the terminology later on. And the small intestine is connected to the large intestine, as you can see, kind of surrounding the small intestine. And that ends with the anus, basically where any unwanted or undigested material gets removed from the system. Now, this slide is really important in terms of, again, both the accessory organs as well as the alimentary canal or the path of food. What takes place in each of these processes in a very brief overview. In oral cavity, you have what we identify as mechanical digestion. Your salivary glands are going to help release fluid that helps you break down your nutrients. You have pharynx is basically pushes the food down to your esophagus. Esophagus sends the food down to your stomach. The job of your stomach is to chemically break down your food using acid and enzymes. And then the food gets passed down to your small intestine. The small intestine is really, really important for 2 functions, for 2 things. First, it's where you have the connection to the pancreas, which is tucked in underneath the stomach right here, as well as the liver and gallbladder. So all of these 3 accessory organs, liver, gallbladder, and pancreas, are connected to the small intestine. And they release what we identified as enzymes and biles that allow for enzymatic digestion of food. Again, that's not mechanical, enzymatic, and then also absorption of the nutrients. Large intestine is extremely important in trying to get more water in, and also try to remove the unwanted material from the system. And again, I'll go into more details in just a few minutes. Alimentary canal, we already mentioned it, but again, it includes your mouth, pharynx, which is also your throat, esophagus, stomach, small intestine, and large intestine, which in some circles referred to as the colon. Accessory glands include your teeth and tongue, as well as the three main organs in the abdominal pelvic region: gallbladder, liver, pancreas, and the salivary glands, which is located within your oral cavity. Now this picture kind of show you the breakdown we described in terms of the small and large intestine. So for the small intestine, you have three breakdown. You have the smallest part, which is kind of up here, called duodenum. The top folds of the small intestine that are called jejunum, and the inferior folds of the small intestine called ileum. Large intestine has quite a few breakdown. It starts with a tiny pouch right here, which connects to the small intestine, called the cecal. Then food starts to go up, so that's the ascending colon. Food goes across, that's your transverse colon. Food comes down, that's your descending colon. Food turns to go to the posterior aspect of the digestive tract, that's the sigmoid colon, which continues down to the rectum, and then anal canal and anus. Now, some of the terminology for digestive process. Ingestion, many of you guys are already familiar with that. That's basically taking the food into your mouth. Propulsion is movement of food down your GI tract. Again, GI stands for gastrointestinal, and includes two processes. The first one, which is under your control, called the process of swallowing, basically swallow your food. And then what we identify as peristalsis. Peristalsis is the movement of food going down, or basically pushing the food down through your digestive system. What you see peristalsis is the green movement that is shown throughout your digestive system. So again, this part right here, that's the swallowing, if you want to call. And then anything going down through the small and large intestine and the stomach, all the green structures, is propulsion, we refer to as peristalsis. The way I think about it is when you are trying to push toothpaste out of the tube, that kind of movement, you squeeze and things move forward. The goal of this, again, is to propel the food forward within the tract. Now, digestion has two types, mechanical and chemical. The word digestion itself implies breakdown. Now, I can break down the food mechanically through a process called chewing, churning of the stomach, churning of the food in the stomach, or a process called segmentation. Now, segmentation is depicted as these green arrows that you can see in, sorry, not green arrows, sorry, purple arrows that you see in the picture. Churning motion is depicted in the stomach, and the chewing is depicted in your mouth. So, what is the difference between segmentation and peristalsis? You can see it's kind of over, they're present in both the structures of the small and large intestine. So segmentation goal is to allow the mixing of the food with the digestive juices. So look at this picture. So this is segmentation on this side. So imagine this is your small intestine in orange, and what you see in the two colors, those are the food. So it contracts here and it contracts here and here. So it's breaking down the food to separate parts. But then this part right here and right here is relaxing, and instead is going to contract right in the middle. So your narrowing down would be here. Same thing with here. Instead of having the contraction of the muscles, of the smooth muscles here and here, you will have it right in the middle. That allows the food to be mixed from these two compartments together, and that allows the better digestive process of the food. Now, the second part of digestion is called chemical digestion. The importance of chemical digestion is that you require enzymes for this. So it didn't mention this, so I would add the word enzymes for yourself to distinguish the main difference between mechanical versus chemical breakdown. After the food has been mechanically and essentially chemically broken down, you will be absorbing those nutrients into your bloodstream. They are depicted as these red arrows that are coming out of the small intestine and large intestine partially and going into your blood vessels. So the word absorption means movement of molecules from the alimentary canal into your blood. And lastly, any unwanted material would be removed through the process of defecation. Now, moving to discussing the different parts of the digestive system. Before I talk about that, just this picture, looking at this picture, you can see the depiction of segmentation versus peristalsis. Peristalsis, the goal is to move the food from mouth to anus. Segmentation is to kind of mix the food and making sure the food is effectively being digested. Peristalsis doesn't necessarily get involved in the process of digestion. Now, we already talked about, again, something about serous membrane earlier in the semester. In case of your digestive system, it's called the peritoneum. We already learned that serous membrane has the double layer, which is the visceral, which is the internal layer, and the parietal layer, which is the external layer. So the layer that comes directly in contact with the digestive organs is the visceral peritoneum, and the outer layers that is lining the abdominal wall would be your parietal peritoneum. The space between these two linings would be your peritoneal cavity or peritoneal space. Now, within these double membrane, serous double membrane, you have sheets of serous membrane that allows the visceral and parietal membrane to connect the organs to the abdominal wall. The main purpose of this, again, the main purpose of having this double membrane in this case, these extra extensions, is because if you don't do that, the organs of the abdominal cavity just fall into the abdominal pelvic cavity. There is no place for them to be basically, there is no way for the organs to stay in place. So you need to attach them to the abdominal wall, basically. You need to suspend your organs inside the abdominal wall. These peritoneum also is a very good way of providing nervous and blood vessel supply to your tissues. Now, these structures, these double membrane that helps you suspend your organs, are referred to as mesenteries. Some of these mesenteries are listed: lesser and greater omentum, mesentery proper, mesocolon, and falciform ligament. Again, briefly kind of going over them and identifying the location of them. Mesentery proper is supporting the long coils of jejunum and ileum, which are the second and third part of your small intestine. Greater and lesser omentum are associated with your stomach. A greater omentum, if you take a look at it in a picture, here's your stomach. The bottom half has a great curvature, so this is a great curvature, or greater curvature, and the one on the top is the lesser curvature. Now, if the omentum is associated with the greater curvature, it's called what? The greater omentum. If it's associated with the lesser curvature, it's called the lesser omentum. So what is the main function of these? Greater omentum connects the stomach, the one that's underneath, to the posterior of the abdominal wall. And in an anterior aspect, it covers the transverse colon and coils of the small intestines. It's literally like a curtain that comes on top of the abdominal organs. Lesser omentum, which is associated with the lesser curvature of the stomach, connects the liver to stomach and duodenum. So in this picture, here is your liver, duodenum is down here, and here is your stomach. The other ligament that you have is the mesentery, which you see right here. This is associated with the coils of the small intestine. And lastly, we have the top one, which is the falciform ligament. This is the line you see right here, separating the liver to two main lobes. And the main goal of the falciform ligament, as you can see right here, kind of going up, it connects to the diaphragm. So this dome-shaped muscle is the diaphragm. So it literally suspends the liver from underneath the diaphragm. Now, we do have what we identify as retroperitoneal organs. These organs are the ones that are associated with, not associated with the peritoneum. And they include pancreas, part of the duodenum, the ascending and descending colon, which are on the sides or lateral, aspect of the abdominal pelvic cavity, and then rectum, which is the most inferior aspect of the colon. Peritoneal organs, on the other hand, include liver, stomach, most of the small intestines, which are folds of ileum and jejunum, as well as the transverse colon. Now, what are the layers of the alimentary canal? So going over this, I'm just gonna depict it very basically, and then I'll show you a picture. Here is the tube where the food passes through, and this tube is referred to as the lumen. So opening where the food passes through, that's the lumen. Now, surrounding the lumen, starting from the esophagus all the way to the anus, you will have 4 layers around this lumen. And these layers may be different going from one organ to another, but they will always be present in terms of the structures. So the first layer that is in direct contact with the lumen is called the mucosa. Again, think about the name. Mucosa implies that it's going to contain mucous membrane, as in it's going to provide lubricating fluid. That is contains the 2 layers, epithelium and a mucous membrane. Submucosa is after the mucosa layer, is underneath it basically. It does contain significant amount of blood vessels and lymphatic vessels and nerve fibers. And underneath that, you have a layer called muscularis externa. Think about the name, guys. Muscularis externa implies that it is made up of muscles. Now, what type of muscle? Since this is digestive system, it would be a smooth muscle. Now, most of the organs will contain 2 layers of muscles called circular muscles and longitudinal muscles, with the exception of the stomach that also has a 3rd layer called oblique muscle. Now, the outermost layer that is wrapped around the alimentary canal is called the serosa. It is made up of a layer of connective tissue as well as epithelium put together. However, if you only have the connective tissue present, we cannot use the word serosa, rather we use the word adventitia. So in an exam, if I ask you guys, list the 4 layers of the alimentary canal from inner to outer, it would be mucosa, submucosa, muscularis externa, and serosa or adventitia. Here's a picture that's depicting the same concept. Again, center would be the lumen. The layer around it, immediately around it, is the mucosa. This layer where you see a lot of blood vessels, right? This layer right here, that would be your submucosa. These two layers right here, look at them, they look like muscles, but they're two different shapes. Those would be your muscularis externa. And this layer that's kind of peeling off, the outermost layer, would be your serosa or adventitia, depending on the presence or absence of the epithelium tissue. Here's another depiction. Again, you have mucosa, submucosa, muscularis as in different layers of muscles, and then the outer layer, which is almost invisible. It kind of more, again, looks like a saran wrap. That would be your serosa. Now let's go ahead and talk about the organs in order. We're going to start with looking at the mouth and briefly go over the structures and also look at very simple definitions of the functions. So your mouth is actually, the mucosa lining of the mouth is made up of a specific type of epithelial tissue called stratified squamous epithelium. This should sound very familiar to you guys because we talked about it in terms of tissue. Stratified implies multiple layers. Squamous implies flattened cells. It also has a mucous layer called lamina propria. Now the cheeks and the lips are involved, the muscles that are associated with this are orbicularis oris, again should sound really familiar to you guys, and buccinator muscles that are on the sides of the face. Here is a picture of the anatomy of the mouth, going over some of the structures on a picture, and then you guys can look at the information on the slides. So here is the oral cavity. You have your teeth. This largest structure underneath is the tongue. Give me 1 second, guys. I'm just changing my pen color. So on top of the mouth, or the roof of your mouth, you have what we identified as the hard palate and the soft palate. Hard palate is more anterior, and it is made up of the palatine process and the palatine bone, if you guys recall that from your skeletal system lab. When you go farther to the back of the oral cavity, there is no bone, so it's just soft tissue, and that's referred to as the soft palate. Soft palate ends with a structure called uvula. So when you are swallowing the food, so if you swallow the food this way, this uvula moves this way, so it closes this passageway right here, which is really important because it doesn't allow the food to go up and come out of the, or associate with the nasopharynx, because again, that on the superior aspect of the mouth would be your nose and nasal cavity. So you don't want the food to have access to that. Now, food is going to continue going down, and the back of the mouth, you have this opening right here, which we learned also associated with respiratory system, called the oropharynx. And then going farther down, the area that's basically allows the food to choose the path of esophagus versus trachea is referred to as the laryngopharynx or laryngopharynx. So this area right here would be your laryngopharynx. So if you're looking at the path of food through the digestive system so far, you have the oral cavity going down to the oropharynx, and then laryngopharynx, and then continue again going down the tube, which we refer to it as esophagus. Remember again, I'm not going over this over and over again. I do expect you guys to recall the information from your previous lectures. This flap of cartilaginous tissue you see right here is referred to as the epiglottis. Epiglottis is going to cover the trachea and making sure food goes down your esophagus rather than the trachea, which is your air passageway. These structures you see on the sides of the oral cavity are your lingual tonsils and palatine tonsils. Tonsils are associated with your lymphatic system and identified as your first line of defense against any type of pathogen, infective agents that either enter through your mouth or through your nose. Couple of other information. If you look at your lips are connected to your gum line, which is kind of these lines you see right here and right here, one top, one bottom. They are identified as labial frenulum. There is a superior one and an inferior one. Hard palate, we already talked about that. Your tongue. So your tongue is a muscular tissue. It's both actually skeletal and a smooth muscle. It helps you grip the food and reposition it and push it to the roof of the mouth for the process of mechanical digestion. For your tongue, the surface of your tongue, which is associated with your sense of taste, you have 3 types of bumps on the surface, and these little bumps are either called fungiform papillae, valli papillae, and filiform papillae. So filiform papillae, which are the dots that you see on the roughened surface of the makes the surface of the tongue roughen, are essential in terms of manipulating the food during chewing. It helps it grasp the food and push it to the roof of the mouth. Valli papillae are essential in terms of taste buds. They're located more toward the posterior aspect of the tongue. And the last category that we have, which is fungiform papillae, are spread throughout the surface of the tongue, and they also act as your taste buds. Teeth, we all know that there are 2 sets of teeth during our life. Deciduous teeth, which are about 20. They start to typically appear around age of 6. And that number definitely varies, and again, it could be lost somewhere around the age of 6 or 7, all the way to age of 12 and 13. And these deciduous teeth are replaced by what we identified as permanent teeth, which are 32. Basically, the difference in numbers are associated with the fact that the jawline or jawbone becomes larger, allowing the mouth to fit in more teeth in. Now, in terms of the breakdown for these teeth, they're color-coded. What you see in blue color, 4 on the top, 4 on the bottom, these are called incisors teeth. Their goal is to cut the food. You have these teeth that are in red, called canine teeth or cuspids. These teeth, there are a total of 4, 2 on the top, 2 on the bottom. And typically in humans, they appear as more sharpened, and their goal is to tear or shred food. So you can see these teeth to be relatively large and very pronounced in animals that, like dogs and cats, or any canine that basically consumes or requires the tearing of their food. In animals like sheep, where they don't require to tear as much compared to canine animals, you have what we identified as premolar and molar teeth. Premolars, also known as bicuspids. This should also sound familiar. Cusp means flaps, right? So these are these patterns you see on the teeth. So if you have 2 of these patterns, they're called bicuspids or premolar. Their main goal is to either crush or grind the food. They are depicted in our picture in purple. So again, 4 on the top, 4 on the bottom. And then you also have what we identified as molar or tricuspids. And the pattern on these teeth, again, there are 3 patterns which identify them as tricuspids. The goal is to either crush or grind your food. Now you have 6 on the top, 6 on the bottom, with a total of 12. Please do note that the molar teeth at the end, all the way at the end of your teeth lines, are also better known as wisdom teeth because they come in later in life. And a lot of times they actually get pulled because it causes the shifting of the other teeth in your jawbone. I love this picture because it kind of shows you both in the x-ray and in the skull how the permanent teeth come in and replace the deciduous teeth. So you have the line of deciduous teeth, but literally if you follow the skull, you can see the other permanent teeth coming in right underneath them. Now, in terms of the anatomy of the tooth, I do want you guys to know both internal and external aspect of the tooth. So the external aspect of the tooth is broken down to three parts. The visible part of the teeth that is sticking out, that's called the crown. So when you get a procedure done and they say they want to put a crown on your tooth, basically the artificial one is replacing your actual tooth, your actual crown. You have the neck region, which is the area where the crown joins the root. And then the root is basically the area that's embedded inside your jawbone. And there can be between 1 to 3 roots per tooth. Internal structure is color coded for you. So what you see here is the top or the outermost layer, which you identified as enamel. Enamel is important in terms of protecting the underlying layer called the dentin. Dentin is what you see in blue. So this structure is dentin. The dentin anatomy, the dentin structure is very similar to bone. So it does have collagen components as well. And it basically forms the shape of your tooth. Now, deep to your dentin, you have what we identify as a pulp cavity, which goes deep inside. Pulp cavity is extremely important because it contains nerves and blood vessels that keeps your teeth healthy and sensitive to its environment. Last thing I want to talk to you guys about is the salivary glands. So salivary glands, there are 3 sets of salivary glands. The job of these glands is to produce saliva, which basically is mostly made up of water. It does contain antibodies, enzymes, some mucus, depending on the type of cells, ions like sodium, potassium, calcium, and digestive enzyme, the main one being amylase. So these type of salivary glands, they are the largest one that are located on the side of your face, right next to your ear. These largest structures are called parotid salivary glands. They are the ones that produce the most watery saliva because they're mostly made up of the cells called serous cells. So when you think about something super sweet, super sour, or if you're eating something that's super sour, your parotid gland basically go into overdrive and release a lot of water into your mouth to basically help you dilute the acidic environment of the mouth. Submandibular, as the word implies, it's built into the mandible. So submandibular is a combination of both serous and cells called mucus cells. So the saliva is somewhat watery, but or somewhat thick, but it's not as thick as what your sublingual gland produces. So this is the sublingual. It's located right underneath the tongue, and it is mostly mucus cells, which implies that they are going to be the thickest saliva your body produces. One important aspect of these salivary glands and saliva, please do know that this is a typical exam question. So when we talked about digestion, we talked about mechanical and chemical digestion. So mechanical digestion of the food will happen for all of your food groups, regardless of the categories, right? So you're gonna break down carbohydrates, you're gonna break down proteins, you're gonna break down fats, regardless. of what category of molecules they belong to. However, you also have what we identified as chemical digestion, which means it requires an enzyme. Now, chemical digestion is done by an enzyme called amylase, and amylase is going to help you break down carbohydrates to simple sugar. So if I ask you guys in an exam, mechanical breakdown of all food groups happens in your mouth, then the answer is yes, because you will chew all of your food regardless of the group. However, if I said chemical breakdown of proteins happens in your mouth, then the answer is false, because you do not have the enzyme that helps you break down protein. If the question asks you guys, I can carry out or complete chemical digestions of carb, then the answer is correct, because I have the enzyme amylase in my saliva that gives me the capacity to break down my carbohydrates into simple sugars. Okay, so we are going to stop here. We'll pick this PowerPoint up in our part 2 of digestive